Y Health is a bundle of services. It includes a facility access, a health coach, and one of our 6 evidence-based programs. A physician prescribes Y Health.
We're here today. We've invited Dr. Mandy Cohen, who leads the Center for Disease Control, because she has been visiting Ys across the country, and we wanted her to see what is happening here right in the Triangle area. It's such a great example of partnership in communities, specifically partnership between the Y and public health, healthcare providers, really focusing not just on healthcare, but overall health. The Y has a long history of partnering with the CDC, and we wanted Dr. Cohen to see that work in action here in the hopes that we can amplify and scale it to more communities across the United States.
Protecting health and improving lives is a team sport. And it can't be something that is isolated to public health or the healthcare system alone. It takes all of us to come together to make sure that our communities are thriving and are healthy and are safe. And so the Y is such an important part of that team effort. I've seen it all over the country, and it's fabulous to see it here in Raleigh, North Carolina.
It's so important for the YMCA to be a leader in the health and wellness space, and to be able to pull this entire group of folks from state government to federal government to local folks and community leaders and nonprofit leaders is critically important as we figure out how to make our communities stronger and healthier, because it's got to be done as a team.
We all see it from different perspectives, and we have different things to bring to it. So CDC, for example, we bring data and expertise and evidence. The Y brings that incredible connection to the community and the programs and the services that they offer. And our health delivery partners, right, are thinking about it from the health delivery aspect, making sure that folks have access to the health services that they need. But no one can do it alone.
So what we need our congressional leaders to understand is that the funding that goes to the Centers for Disease Control is critical to the success of our programs. That's how we've started all of this work and built our infrastructure. In addition to that, we need some systems change at the federal level to be able to allow us to be able to make this a sustainable model moving forward, because what we're finding is that we have to do this work with grants, and grants have an end date.
One of the reasons we wanted Dr. Cohen to come see the work at the Triangle, because it's a really amazing model where the Y is actually providing a prescription of health to people in the community to focus on a whole range of chronic diseases, and it's being paid for by healthcare providers. So it's allowing the Y to do what it's best, and it's getting funded in a way that is making it more accessible to community members who need it.
Community members trust the Y, they know it as part of their neighborhoods. And so when someone at the Y says, we need to talk about healthy eating, or about moving to feel better, or taking care of your mental health well-being, those messages will carry further to drive behavior change than anything that you're going to hear in other places.
20% of health is clinical, and that means 80% of health is your day-to-day wellness. And that's what the YMCA is all about. It's about taking care of yourself mentally and spiritually and your body. It's about belonging. The YMCA is a place where people come and find relationships and connections that help with all of the parts of your health and well-being.